Hey everyone, this is Discussions with Dr. G, and I am, of course, Dr. G. Today we're kicking off our wild ride through the history of community health nursing. You know, the roots go way deeper than just Florence Nightingale and those old-timey starchy white hats. Let's rewind, like majorly rewind, to ancient Egypt, India, Rome. These folks were pretty serious about hygiene, even if they didn't really know the whole germ concept yet. Think of religion as their infection control policy. Ritual hand washing, baths, sanitation, all tied to spiritual purity. Ancient India had these elaborate water systems to separate clean and dirty water, and the Roman engineers were basically the public health nurses of the ancient world, just without the scrubs or the "why are you still up in the middle of the night shifts." True story, picture a Roman aqueduct. The fact that without even knowing bacteria existed, the Romans connected clean water to, not dying of weird diseases. That's infrastructure meets health, ancient style. But things got less glamorous, let's say, in the Middle Ages. Seriously, the Middle Ages were not a great time for anyone's life expectancy. If you got sick, you were usually cared for by your family, unless you were extra lucky and got the nuns or the monks. Religious institutions sort of doubled as the first hospitals. It was all very bring out your dead, but way less Monty Python and more just, desperate. Nuns and monks were those OG organized care teams. That all starts to change in the 1800s, okay? Enter Florence Nightingale. She pretty much shows up with her lamp and just revolutionizes the whole idea of nursing. She figured out this wild idea. If you have better sanitation, people die less. Mind-blowing. Nightingale actually focused on clean air, water, good nutrition, and the importance of cleaning the actual environment. She's like the MVP of evidence-based practice before evidence-based became a buzzword. Then there's the Shattuck Report out of Massachusetts, which basically called out American cities for being, gross and linked bad sanitation to disease. That report really set up the framework for public health systems in the U.S. So basically, Nightingale was doing her thing in England, Shattuck in the U.S., and together they were like the Taylor Swift and Beyonce of the 19th century health reform. You can't talk about this era without shouting out Lillian Wald. She kicks off what we know as public health nursing, starting the Henry Street settlement in New York, and she set up this visiting nurse service. She's also one of the first to advocate for school nursing. Lillian Wald wholeheartedly believed that where you live and work matters for your health. She's like the queen of social determinants of health, decades before it was a PowerPoint slide. And Jessie Sleet Scales, she's a legend in her own right. The very first Black public health nurse. She co-founded the Stillman House, the Henry Street branch serving Black families, and tackled tuberculosis in underserved communities like a boss. Now, why were places like Henry Street Settlement so crucial? It's simple. There weren't just patching up people who showed up sick. They were getting out into the community and preventing diseases, fighting for better housing, basically the starters of upstream thinking. This reminds me of my first day teaching nursing students. I tried to impress them by talking about standing on the shoulders of giants. Not sure if that hit or if they just thought I was obsessed with really tall people. But seriously, knowing who literally paved the way, it's everything to how we see our roles now. So let's talk disease detectives and vaccine game changers. Edward Jenner. Guy takes cowpox from a milkmaid and comes up with the first smallpox vaccine. I mean, there had to have been some wild dinner party conversation after that one. Then you got Jon Snow, a personal fave of mine, not just a Game of Thrones character, guys, but the doc who figured out a London cholera outbreak traced back to one contaminated water pump. He's seriously the Sherlock Holmes of germs, and that's where epidemiology is basically born. You see that same detective work with nurses today. I remember tracing COVID-19 outbreaks and thinking, this is modern day Jon Snow. Well, minus the top hat and a complete lack of hand sanitizer. But the hunt for patient zero, mapping hotspots, it's timeless work, and nurses have always been at the front lines of it. Now let's fast forward. 20th century. Boom. And we're seeing nurses respond to everything from the 1918 flu pandemic, plug for hydrating patients, managing fevers, basically doing the very best with the very least, to COVID-19, where we showed up for testing, vaccinating, all of it. Nurses got some support with Shepherd-Towner Act, which focused on moms and babies. Nurse Training Act, which helped finally end the exclusion of black nurses from the Red Cross and the military. Here's the takeaway. Whether it's ancient engineers building sewers, Nightingale scrubbing everything in sight, or you mapping outbreaks with an iPad on a Tuesday night, community health nursing is about seeing what no one else sees, solving what no one else wants to touch, and always advocating for the vulnerable. That's where we end for today. If you learned anything, go thank a nurse. Or if you are one, remind yourself you're part of an epic history. Catch you next time when we dig into advocacy and nursing leadership. Until then, Dr. G out.